Shelley is a 50-year-old single mother who was diagnosed with rheumatoid arthritis 2 years ago, with sudden onset at age 48. She lives in a 2-story house with her teenage son and 2 golden retrievers. Shelley currently experiences pain, stiffness, and swelling in her hands, metacarpal, and interphalangeal joints. Additionally, she has recently begun to experience pain and stiffness in her ankle joints. This has made it difficult for her to complete self-care activities such as brushing her teeth, brushing her hair, and getting dressed in the morning. In addition, it is becoming increasingly difficult to prepare meals at home for her family. Outside of work, her leisure occupations include knitting and baking for the local homeless shelter. She also enjoys outings to the community center to watch her son's hockey games and walking her dogs. The Saskatchewan climate is relatively cold, and Shelley finds that the cold exacerbates her existing symptoms. During periods of flare-up, she finds it very difficult to use her hands because they're stiff and swollen, which adds a significant amount of time to her morning routine. Shelley has been a full-time emergency room nurse at the Fort Saskatchewan Community Hospital for the past 20 years. She is very passionate about her work as a nurse and has strong friendships with her colleagues. Recently, Shelley has had to take a leave of absence from work at the hospital. She was struggling to perform important tasks, including administering needles and medications to patients and handwriting chart notes. Shelley reports that when at work, her fatigue and joint pain were becoming increasingly difficult to handle. Shelley finds that overall her joint stiffness is the worst in the morning and that her pain is the worst in the evening. The nature of Shelley's work requires that she's constantly moving and completing rounds between her patients, which has become physically taxing. Shelley's coworkers provide support to her when they can, but her supervisor places pressure on her that her patient care must not be compromised while she's at work. Shelley's family doctor referred her to occupational therapy to help manage the issues she is having as a result of her flare-ups. As part of the occupational therapist's initial assessment, she administered the McGill pain questionnaire to better understand Shelley's pain and have a baseline measurement prior to intervention. This assessment measures qualities of the subjective pain experience in clients with chronic pain. It is a quantitative measurement designed for use in adolescent and adult populations, ages 13 and older, experiencing chronic pain. The questionnaire contains 78 items that describe pain from the Pain Rating Index. Each item is categorized into a subclass, which is allocated to one of 4 major subscales: sensory, affective, evaluative, and miscellaneous. Additionally, there is one item pain intensity scale.
Thank you. So since this is our second meeting together, I was thinking maybe we can move on with our assessments and get you to fill out some little questionnaires for us.
Okay.
Does that sound okay with you?
Yeah, that's okay.
Okay. So the one I have in mind is it's called the McGill Pain Questionnaire.
Okay.
It takes about 20 minutes to complete, so it's not too long. Well, you'll circle right on here where your pain is located on the body, and then there's 3 sections in it. So the first one is, what does your pain feel like? The next section is, how does your pain change with time?
Okay.
And then finally, how strong is your pain?
Okay.
So I'll just give you a couple examples from each section.
Sure.
In the first section, you'll choose one of the following words: flickering, quivering, pulsing, throbbing, beating, or pounding to describe your pain.
Okay.
And then I'll just go through this list of questions and just circle one from each of them.
Okay.
And the next section, one example is, does the cold increase your pain?
Okay.
And then you'll go through, answer all of those. And in the final section, which word describes your pain right now? So for example, mild, discomforting, distressing, horrible, or excruciating. So one of the following.
Okay.
Do you have any questions about that so far?
What if I don't know what one of the words means?
You can just ask me anytime. I'll be right here. Take as long as you need to finish the questionnaire.
Okay.
Does that sound okay?
Yeah.
So you can just get started and let me know when you're done.
Okay.
The first part of the McGill Pain Questionnaire requires the client to mark an X on the anatomical drawing where they are experiencing their pain. The client is given a standardized list of 20 general pain symptoms and are asked to select the ones that best describe their pain. For example, temporal and spatial. The administrator totals the number of these symptoms that were chosen. Next, each general pain symptom has a subset of descriptive words that are assigned a certain point value. Example, flickering is valued at 1 point and pounding is 6 points. The administrator totals the number of points in each group as well as the number of points chosen overall. Part 3 is the present pain intensity scale. This is based on a 1 to 5 intensity scale that indicates overall pain intensity. It includes 6 levels: none, mild, discomforting, distressing, horrible, and excruciating. The client selects the word that most accurately suits the intensity of their current pain. The administrator totals the number of points chosen.
Treatment planning will be very individualized and dependent on the client's scores and their goals. The administrator will score the MPQ and then look to create a treatment plan for the client. Treatment planning for chronic pain can include, but is not limited to, splinting, hot and cold therapy, rest, strengthening exercises, and stretching exercises. The clinician will work with the client to set goals and engage in treatment planning depending on the amount and type of pain that the client is experiencing.
Hi Shelly, how are you?
Good, how are you doing?
Good, thank you. How have you been feeling since the last time we met?
I've actually been feeling a lot better. The hot and cold therapy that you suggested has been working, and also the splints that you made for me for my wrists have actually been helping a lot, that I've been able to go back to work part-time, which is really nice.
That's great, yeah. So I think now would be a good time to look at the McGill Pain Questionnaire again.
Okay.
And I'll just get you to fill it out as you did last time, and then we'll compare it to what you did 3 months ago.
Okay.
Do you remember the questionnaire, or do you have any questions?
Yeah, I think I remember it, and no, I don't, no questions.
Okay. If you do have any questions as you're writing it, feel free to ask.
Okay, perfect.
Thanks.
Because pain is a subjective experience, there are no normative scores available. The minimum pain score possible is 0, while the maximum is 78. The higher the pain score, the greater the pain being experienced by the client. Higher pain scores are more likely to negatively affect usual participation in occupations. As the pain experience is subjective, the interpretation of scores will vary for each person. Therefore, the client and clinician must work together to understand how the pain is affecting daily occupational performance. By comparing the changes in MPQ scores over time, impact on occupational performance can also be monitored and addressed through intervention.
Current literature reports reliability and validity of the McGill Pain Questionnaire, which supports the clinical utility of the assessment. The questionnaire is a tool that can be used globally. It is available in 44 different versions, which represents 28 different languages and cultures. The McGill Pain Questionnaire is a beneficial tool due to the ease of administration and scoring. There is no training required to score or administer the questionnaire other than the ability of the interviewer to define each word. In addition, the scoring of the questionnaire only takes 1 to 2 minutes and provides objective data. Finally, the McGill Pain Questionnaire can be administered in a range of environments, as the only equipment required is a pen and paper. The McGill Pain Questionnaire requires the understanding of vocabulary that may be challenging for those of low literacy to comprehend. If administering the questionnaire to this population, this could result in confusion and frustration in the clients, as well as an increase in the required time to complete the assessment. Another limitation is that language versions beyond English may not have accurate translation of descriptor items. Testers must take this into consideration when comparing pain populations across cultural groups with different languages. Finally, the McGill Pain Questionnaire can take up to 20 minutes to complete, which may also be a barrier to those with cognitive impairments impacting their attention levels.
After completing the McGill Pain Questionnaire a second time, Shelley's scores decreased, indicating that her pain has improved over time. She's now able to get back to the occupations that she enjoys.
The MPQ was the first multidimensional pain assessment tool developed that considered both the severity and intensity of pain, as well as the emotional impact and the significance of pain to the individual. Quantifying the experience of pain is critical to evaluate interventions intended to control it. Additional versions of the MPQ have been created, which include 2 short-form questionnaires, the SF MPQ and the SF MPQ-2. These short-form questionnaires are more sensitive to change over time, have an increased focus in the selection of sensory pain descriptors, and lessen the demands placed upon the client and the clinician. It is recommended that clinicians consider all versions of the MPQ based on client suitability.